my name is Gabrielle Terry, and this is my clinical reflection presentation. So, objective one is to utilize previous knowledge of the sciences, liberal arts, information technologies, and nursing to develop skills as a nurse leader. So, I personally felt that I met this objective through my peer leadership experiences, in which I had to utilize my previous knowledge from my own classes and clinicals, and I was able to share this information with the leaders or my peers, so they'd be able to excel in their classes. Um, example of how I did this was in NUR 320. Following their sim experience, I basically gave them feedback on how I thought that they handled the experience, and then I gave them tips and advice how I thought they can improve upon what they just did, so they'd be able to master the skills in the future. I thought I also accomplished this objective through a radio show segment that I created with a partner, and for the segment that we basically used our previous knowledge that we acquired from our own classes, such as mental health, and basically through this previous knowledge, we taught the community ways that they can improve one's mind and body, especially during the pandemic. So I felt that these experiences connected to the leadership concept of followership within the Sullivan textbook. And I felt this way because I got to see firsthand how basically the instructors interact with students outside of my own personal experiences. And students and their instructors basically share the overall goal of basically gaining experience through these clinicals. But basically, the effort that the students put into the experience is what determines whether the goal outcome is going to be positive or negative in the end. So, for objective two, it is to apply the basic principles of ethics and management to meet the challenge of an ever-changing healthcare environment. So, I felt I met this objective through my patient logistics experience, in which I shadowed under a bed management nurse named Roxanne. And during this experience, the nurse leader basically demonstrated the basic principles of ethics to meet the ever-changing healthcare environment. And she did this by upholding the code of ethics for nurses. So, one particular provision that I noticed that she emphasized was Provision 5. And Provision 5 is the nurse owes the same duties as to self as to others, including the responsibility to promote the health and safety, preserve wholeness of character and integrity, and maintain competence and continue personal and professional growth. So, she demonstrated this by admitting to me that though she has been in this position for many years, she's still constantly learning new things because the environment is constantly changing, and especially with the pandemic among us. And due to this, she basically had to change the way she does things because, for instance, right now there's very little beds available, or basically none in some hospitals, and basically they have to find she has to find where to put them. And based on Sullivan, I thought she accomplished the role of a quantum leadership style. And basically, this is based on the chaos theory. And her role basically demonstrated that her role basically demonstrated that like while she was working, that there's just so many different things occurring all at once, and she has to decide which tasks she's basically going to delegate and which ones need to be prioritized. But in the end, it doesn't really matter though which technique is she's using to do this, as long as that the end result is going to be a positive outcome. Also, branching off this, I also thought that her delegating task applied to the basic principles of ethics for this objective, particularly Provision 4.1. And this provision means nurses are accountable and responsible for the assignments and delegation of nursing activities. So basically, through delegating, I thought she accomplished this. So Provision 3 is it demonstrates leadership skills through effective use of communications by representing the self, the college, and nursing in a professional manner. So I felt that I met this objective by sending confirmation emails to my peer leadership experiences. And through these emails, I was just basically able to introduce myself to the nurse leader, my purpose for attending this experience, and I was also able to clarify through these emails what I needed to do to prepare for the clinical, so I'd be able to achieve the most successful leadership day possible. I thought I also met this objective through sending thank you letters, for instance, to my nurse leader for patient logistics. And basically, according to Sullivan, by sending this thank you letter, I demonstrated the leadership concept of formal communication to the nurse leader. And through this letter, I was basically able to represent myself, the college, and I did this by conveying my gratitude for the opportunity as well as writing things that I was able to take from the experience to show what I learned to the nurse leader. So objective 4 is to critically evaluate and disseminate current research to the principles of leadership and the effects on the healthcare system. So a nursing leader article that I found is the impact of nurse leadership styles on nurse burnout, a systemic literature review. And basically, this article is a study that addresses the responsibility of being a leader and how this can cause nurse burnout from the different stresses within the healthcare environment. So healthcare basically needs to find a way to fix this problem because nurse burnout and stress can pose a very significant hazard to patient safety, and it decreases the productivity of workers. So this study conducted a systematic literature review with incorporation of a model called the preferred reporting items for systemic review meta-analysis, and basically it had the overall purpose of finding which leadership styles have the least amount of burnout. And the results basically showed that authentic leadership and transformational leadership presented with the least amount of burnout. And transformational leadership is actually a component that we previously touched upon in class, and according to Sullivan, it means that the leader inspires and motivates followers. It emphasizes the importance of interprofessional relationships and are not concerned with the status quo, but rather with affecting revolutionary change in organizations and human service. So therefore, I've had met this objective through disseminating my research article and linking the leadership styles of authentic and transformational leadership to the ability to decrease burnout within the healthcare system. So objective 5 is function as a competent patient advocate, nurse advocate, and change agent. So I feel that I met this objective through my political and legislative event called Fair Districts Now, and basically the host of this event taught me how to be a change agent within the community by combating the problem of gerrymandering. And gerrymandering basically is when the electoral district boundaries are manipulated basically to favor a particular political party. And the event leaders basically emphasized that in order to advocate for and fix this problem, we all need to team up together, including nurses as well, to spread the word of this problem because, to as many people as possible, because the more people there are, there's just more power in numbers. And I thought this related to the leadership concept of teams, and according to Sullivan, basically it means real groups in which individuals must work cooperatively with each other in order to achieve an overarching goal. And basically by teaming up and addressing this problem with local politicians, it's a much higher chance that the problem is going to be addressed and fixed if more people are conveying this problem to them. And by this problem being fixed, it will actually create a voting system that fairly elects candidates that the majority of people actually voted for. And nurses should also be advocating for this resolution to the problem because elections impact which improvements are going to be made upon the healthcare system and or whether or not it's going to be negatively impacted depending on which candidate is going to be elected in. And if it's unfair, it might not be a good outcome. So another political event that I thought that probably helped me meet this objective was attending the 313 mental health clinical at the hospital. And the importance of patient advocacy was definitely emphasized because patients in the state are very vulnerable, and therefore it is the duty as a nurse basically to make sure that these needs are going to be met as well as that the patient's safety is upheld since they're just in a delicate state at that point. So objective 6 is to formulate plans for continued personal leadership growth and development as independent practitioner of nursing and contributing member of society. So I think I was able to meet this objective through continuing education courses that I participated in throughout the semester. According to Sullivan, continuing one's personal growth and learning is a leadership concept that can be achieved through providing leadership or learning opportunities that increase an individual's skill and abilities. So, for example, I attended a treatment trend session, and I was able to expand my knowledge base on the individuals within the community dealing with substance abuse and problems. And this wasn't something that I had a lot of knowledge on before this event. And basically, they were able to show firsthand experiences on basically that substance abuse can just happen to anyone, and you might not even see it coming. And they showed how to handle the situation. And I was basically able to learn that it's important to listen to these infected individuals in their backstory, because basically talking over them and forming a care plan immediately without listening to the backstory, it can just lead to a very unsuccessful outcome in the end. I thought this session also just basically served as a stepping stone to improving patient care, because it taught the signs of substance abuse to look out for and just demonstrate justice to these patients and not judge. Um, Another event I also attended was the Lehigh Valley Health Network Innovation Session. And during the session, it was just encouraged for learners to open up about their mindset and expand their knowledge regarding the different nursing fields by learning about midwifery. And I learned these skills and limitations of nurse midwives, and where there are job opportunities, as well as basically the different approaches that you could take regarding patient care, because it's just very different compared going from different profession to profession. And I was just basically able to gain an understanding of the field and create a connection on how the care differs. Um, and as well as how, in the end, even though it may differ, the main goal is to create a positive outcome and hospital experience for the patient. So Objective 7 is to recognize the role of nurses in policy making related to healthcare services at local, state, and national global levels. So I felt I was able to meet this objective through a Susan Wild political event I attended, and she basically emphasized that she is fighting for it's called the Paycheck Fairness Act, and if it gets passed, it will require that if there's a difference basically in pay between men and women, businesses have to provide the evidence why there's a difference in pay. And basically, this can benefit nurses by decreasing the pay gap there may currently be in some healthcare environments. So I also attended a session with Mike Schlossberg, and he expressed that he's fighting for the National Guard to come in and assist with COVID vaccine distribution. And basically, this could benefit nurses by taking away the stress of being understaffed, because they would be helping with giving the vaccines out, so there'd be more nurses be able to focus on patient care rather than giving the vaccines out. So according to Sullivan, the leadership concept of politics should not actually be a negative thing. It's a way to make a difference for your patients, your profession, and yourself. So I thought both of these individuals really emphasized that nurses can play a huge part in policymaking by going out and just voting for a change in the workplace for healthcare. So, Objective 8 is to predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. So, in the ANA Code of Ethics for Nursing, Provision 3.1 stated that protection of the rights of privacy and confidentiality of the patient is the responsibility of the nurse. So I was able to basically accomplish this objective through the provision, through the Hearing Voices sim that I participated in, and basically during the sim, I try to emphasize as much as I could to the students the importance of checking patient bracelets before sharing medical information, because if I was the wrong patient and they shared someone else's information with me, that would be breaking patient confidentiality. So I made sure to really express that to them. So also, according to Provision 3.2 within the Code of Ethics, this states that nurses are responsible for the protection of human participants in research. And basically, I think I noticed this. So when I was attending Lehigh Valley Health Network Grand Rounds event, it was emphasized by the leaders that the identity of patient participants in the nurse residence projects, that it was being protected and confidential, and it could have been an ethical dilemma if they were to reveal the identity of the participants, but they upheld their ethical responsibilities as nurses by not revealing it. So basically, this is the end of my clinical reflection presentation. Thank you for listening.